Isang maganda at mapagpalayang umaga. Good morning mga kapamilya. Welcome po sa Thank You Doc. Si Alvin Elchico po ito. This is a taped episode. Pero di bali po, kitape, live, marami po kayong mapupulot na aral at kaalaman tungkol po sa ating topic for today. Siyempre, di po kumpleto ang diskusyon kung wala po si Ate B. Bernadette Sembrano-Aguinaldo. Ate B, belated Mother's Day. Actually, pwede iswak sa Mother's Day kasi di ba Mother's Day is kalagitnaan ng May, di ba?
Ano nga ba, hindi rin ako relate talaga sa Mother's Day dahil alam mo naman, tayo ay fur mommy. Alam ko
Happy
May 7
Mother's Day.
May 7. Oo, May 7 ang Mother's Day. Ano? But anyway, ito po ay para sa ating lahat, mga kababaihan. Nanay ka man, kapatid, ate, tita, para po sa ating ito. Actually, pati rin pala sa lalaki, meron rin ito. No? Pag-uusapan po natin ay breast cancer. Pero, may pag-asa pala ang breast cancer. Minsan kasi pag narinig po natin yung breast cancer, alam natin, cancer nakakatakot na. Apparently, may maagang mga nagagawa naman para sa mga may breast cancer. At para magpaliwanag tungkol dyan, ang ating eksperto for this morning, Dr. Herdee Luna. Good morning, Doc.
Hi, Doc Herdee. Good morning.
Hello po. Good morning po.
Ayan. O, sige po, umpisahan po natin yung ating diskusyon. Ano po? Sa mga kababayan natin na nakamonitor, pasensya na po, wala muna tayong mekanismo para makapagtanong po kayo. Hopefully, matanong po natin yung mga basic questions for all of you. But please, pakishare nyo pa rin po ang discussion natin kasi kahit papano, may makukuha po tayong aral. Ano po? Doc, yung breast cancer, yan ba ay environment po yung cause? Or yan hindi, hereditary yan. Kahit anong gawin mo, kung sa pamilya ninyo, nasa genes ninyo, talagang magkakaroon ka ng breast cancer. Go, Doc.
Yes po, Sir Alvin. Tama po kayo. So, kadalasan po ng breast cancer ay mapupulot po sa tinatawag na sporadic mutations galing po sa environmental chemicals or damages na pwede po makuha po ng individual over time. So, meron din pong around 5 to 10% na genetic or hereditary na tinatawag.
So, both. It can be caused
Yes.
by both factors. So, isa-isahin natin. Unahin natin yung hereditary kasi kamo 5 to 10% lang na hereditary. Ano po? Saan ang gagaling po? Sa nanay, sa tatay, sa lola, sa lolo? Di ba may pinagmulan yun? Kasi may family tree po kayo, hindi ho ba?
Yes po, Sir Alvin. So basically po, down the line from your ancestors po, meron po mutations na na-acquire sila and then pwede po to maipasa po sa mga anak o kaya sa susunod na henerasyon. So hindi naman po particular na mothers only, mga lalaki din po pwede po magkaroon ng breast cancer at pwede naman din po itong maipamana.
Ang problema, Doc, hindi mo malalaman kung saang henerasyon siya talaga magmamanifest. Ano po, kung sa first ba, second ba, third ba, o yung mga susunod pa na na lahi ninyo.
Yes, sir. So, important po dito kapag may history po ng breast cancer po sa pamilya, kailangan po magpa-genetic counseling po para mailaman kung ano po yung risk ninyo. Pwede din po magpagawa ng mga genetic screening at saka po mga evaluations, mga risk assessment tools para malaman po yung chance ng risk ninyo magkaroon ng breast cancer at kung paano ito mapapreventahan. Meron po tayong mga pamamaraan para po mabawasan yung probabilities or chances of getting breast cancer, lalo na pag strong family history. So, meron kang surgical, meron kang medical na reducing this breast cancer incidence po.
Ibig sabihin, bago lang natin umalis dyan sa topic na yan, kung ang lola mo ay namatay sa breast cancer, ang nanay mo ay nagkaroon din ng breast cancer, is there a big chance na ikaw, as the third generation, magkaroon din nun?
Yes po, sir. Pagka immediate family po, you have at least 2 to 3 chances or times na you'll acquire breast cancer po.
Okay. Ate B?
Ang taas nun, ha?
Ang taas, no?
Ang taas 3 or 4 times. Pero sabi mo kanina, Doc, 5 to 10% lang. Pero nagulat lang ako na kapag nasa lahi, sobra kang at risk. Doc, breast cancer lang ba o any kind of cancer? You will be at risk. Kunwari lang, cancer, pancreatic cancer, o talagang dapat breast cancer din?
So, meron po tayong tinatawag na syndromes, cancer syndromes. Mga cluster po sila ng mga cancer diagnosis na pwede pong magkaroon sa family, sa sa ancestral family tree na pwedeng iba't ibang types of cancer. May mga clusters po yan. May mga tinatawag na breast ovarian syndrome po. So may breast, may maririnig kayong may family history ng breast, pwedeng may family history ng ovarian. So, meron din pong kagaya sa mga BRCA mutations. Mga BRCA mutations pwede po sa iba pang types of cancer like prostate, pancreatic, so breast and ovarian given na rin po yan.
Sa environment, ano yung
Yes
sa
po.
environment na nagko-cause ng
Alright
breast
po.
cancer? Isa-isahin niyo po.
So basically, we have modifiable and non-modifiable risk factors, no? Yung sa environment is kadalasan mga modifiable risk factors, gaya ng obesity. Obesity is linked to at least 13 different kinds of cancer. So, ang obesity is linked to inflammation, and inflammation is very much linked to changes in hormone levels. So, predisposed po ang individual to have this inflammation and changes in the hormones that could predispose or malink po dito sa types of cancers na to, particularly breast cancer. Isa na din po yung hindi pag-ehersisyo, no? So kailangan natin may moderate exercise po, at least mga 45 minutes a day, no? This also reduces yung excess hormones sa katawan. Itong excess hormones naman na to, again, magli-lead sa inflammation, then magte-trigger na ng changes sa genetic level, and pwedeng mag-predispose again ng mga certain kinds of cancers and including breast cancer. Tapos alcohol, for instance din po, no? So itong excessive alcohol, so ang kadalasan nire-recommenda is isang baso ng alcohol lang kada araw, pero pag labis may mga 20% chance na pwede ka nang magkaroon ng breast cancer kapag 2 to 3 glasses or bottles ng any type of beer or alak.
Ano-ano ba yung
Yes.
mga diet sa kababaihan at kalalakihan na pwedeng, hindi sinasabing automatic na magkukause, pwedeng mag-cause ng breast cancer?
Opo. So, sa mga pag-aaral, yung low in processed meat and processed food, yan po yung mga medyo mas safe. So, eating fruits and vegetables po, they improve our immune system, and also yung mga chemicals na nakuha natin sa pagkain, pwedeng easily maidumi natin, no? Kasi pag bulky yung food, high in fiber, pwede siya easily hindi ma-absorb. But again, excess in everything. So ang main message is moderation. Excess in any food is also bad, no? Be it sweets, and also yung salty, for other kinds of diseases like cardiac diseases po, at risk din po. And
Totoo
Doc,
ba yun?
narinig mo na ako?
yeah, naririnig ko na po.
Ayan, Ate B, follow up ko lang yung sa pagkain, kasi nandun na tayo sa pagkain. So sabi niya, anything in excess, it may lead to cancer. May narinig naman ako dati na ang pagkain daw ng cancer cells ay sweet food, sugar. May connect ba yun? Totoo ba yun? Na pag mahilig ka sa sugar, yun daw yung fuel ng cancer cells. Is that true?
Sir, sa laboratory, sa mga Petri dish, no, cancer cells really thrive on sweets. However, it was not translated sa mga humans. Mainly because, there could be a lot of factors. Maybe humans really move a lot. Kung nag-exercise, mabuburn mo naman yung excess sweets. So, hindi siya na-prove sa humans, and hindi naman sinabi talaga yung reason kung bakit eating sugar will not cause cancer. I mean, most of us naman, we have some form of sugar in our diet. It doesn't cause cancer, but excess, gaya ng leading to obesity, will trigger changes in our hormone levels, tapos inflammation, then it could destroy.
Kasi if that is the case, yung rice, sugar din naman yung rice eh. Araw-araw nakain tayo ng rice, hindi ho ba?
So I believe yung sa Petri dish is very different doon sa human aspect, dahil may movement tayo, we use sugar as a source of energy every day. So hindi siya nag-translate nga sa studies. And best pa rin is to keep healthy, stay fit, exercise, move a lot, and moderation pa rin sa pagkain para hindi.
Ate B, let's try it. Go, Ate B.
Yung hormones mo,
Ayan.
Doc. Minsan daw yung hormones daw sa mga kinakain natin, sa mga manok, yung karne, yan ba ay meron ring dulot sa atin na nakakadulot rin ba ng cancer? Or breast cancer?
Opo, medyo difficult po yung question kasi ito pa yung hormones para lumaki yung mga products po ba?
Growth,
Tama ba?
growth hormones.
Growth
adjustment ng
hormones.
ano.
Yes, oo.
Oo, yeah. So, hindi naman siya na-translate into studies. I have no known studies na nagbalita ng ganito. However, organic food at saka yung walang preservatives and as well as less chemicals no dun sa kinakain natin is very sound po
Okay.
siya. Oo, go natural
Nice.
parang ganun po.
Ah,
Opo. Kasi
so mas
any
maganda.
chemicals in excess
Bad talaga.
Bad.
may possibility na I mean we haven't conducted all studies na regarding a particular chemical, no?
Okay.
Pero the future will tell us kung ma-associate yan. Like in the past, they felt that smoking is a new drug na it's very good. They feel good. But later on, after a decade or so, na-associate lang siya with some forms of COPD, lung diseases and lung cancer. So it's possible na we're still in that time na hindi pa natin alam yung mga sagot sa mga tanong na ito, but the future can tell us kung ano yung kahihinatnan if we have excess of these. Oo.
So magpaka-healthy lang tayo. But anyway, Doc, sige, puntahan na po natin yung cancer mismo. No? Ano bang nangyayari sa ating suso kapag tayo ay mayroong breast cancer? Ano ba yung mapapansin? Butlig ba yan? Malaki ba yan
Bukol.
agad? Oo. Nagsasimula ba yan sa kilikili? Paliwanag nyo naman please, Doc.
Opo. So, sa mga kababaihan, meron po tayong mga glands, milk ducts. So, ito po ng mga natural po na parte ng ating katawan. Kapag po merong damage dito sa mga cellula, mga tissues and cells doon sa breast, pwede po ito magkaroon ng abnormal growth. Kapag po nagkaroon ng abnormal growth, dumadami po yung cells. So, yung mga maliliit na cells nagka-clump together, later on, magiging maliit na bukol, lalaki later on, magiging malaking bukol, pwede na siyang makapa, depende sa lokasyon. Merong mababaw na bukol na makakapa, merong malalalim naman ho. Meron naman po, kapag agresibo yung bukol, o kaya po, matagal na po yung bukol sa katawan, pwede na po silang kumalat sa ibang bahagi ng katawan. Ang una po nilang dadaanan na yung mga kulani na tinatawag. Ito po yung mga daluyan ng mga lymph, no? Usually, ito ay pang-protekta against viruses. However, pwede na siyang daluyan ng breast cancer cells papalabas. So, mula sa dede o sa suso, pwede na siya pumunta sa kilikili at pumunta sa iba't ibang parte ng katawan. Kadalasan, pwede itong pumunta sa karatig breast, yung sa opposite breast, pwede din po sa baga, sa liver, sa bones, sa brain. Opo. So, ito po yung breast cancer. Ano yung mga symptoms nito initially? So, kailangan malaman ng ating mga kababaihan ng tungkol sa mga unang signs ng breast cancer. Kasi, ang treatment po, meron available services tayo ngayon through government health. And earlier detection, yung earlier na ma-recognize mo ang mga sakit na ito, at ma-refer ka natin doon sa mga doktor para matulungan kayo, the earlier detection, earlier treatment gives us higher chance for cure. So, ano ba yung kailangan natin malaman? So, lump or parang bukol doon sa breast, pwede din po siyang may discoloration, pagbabago sa kulay, sa kutis, sa hugis, sa dede. So, pwede itong tumigas, pwede itong maging fixed or hindi magalaw. Tapos, pwede din po magkaroon ng kirot, lalo na hindi nawawala, especially after menstruation. Tapos meron din pong signs and symptoms na pwedeng may discharge, oo, at pwede din po merong sa nipple area. Tapos pwede din po ng bleeding doon sa nipple area. Pwede din magkaroon ng uka doon sa balat, sa dede, at pwede din po kasing magkaroon ng dimpling na tinatawag, yung pagbabago doon sa balat. Yung parang hugis o kulay orange. Pure de orange ang tawag namin doon. Tapos
yung simple kate.
Pwedeng pamumula, pangangate, at associated din po sa iba't ibang signs and symptoms. So, hindi lang yung pangangate na hindi to nawawalang pangangate, pamumula, at may makapal medyo makapal po yung balat. At the same time, pwede din po kayo makakapa ng kulani sa kilikili at saka po dito sa may collarbone. Oo.
Pati lalaki, ganun din yung sintomas, no? Kasi di ba sabi niya, Ate B, yung lalaki pwede din magkaroon ng breast cancer eh.
Yes po, yes po. So sa mga kalalakihan, kadalasan yung lump, opo, yung may bukol ang nakakapa nila at saka pain, opo.
Okay.
So, fine. So,
Mm.
na-diagnose ka na, no? May cancer ka. Tell us something about the stages. Marami stages, hindi ho ba?
Yes po.
Mm.
Opo. So stage po, basically we have 0 to 4. So yung 0, hindi siya kumakawala doon sa tinatawag namin na basal membrane, no? Basement membrane. Hindi pre-cancer pa ito, hindi pa to talaga yung invasive na kumakalat. Stage 1 is when meron tayo sa isang bukol sa isang parte ng dede at pag pa-advance ng pa-advance, stage 2, 3, meron na yung mga kulane na nai-involve, pakalat na rin po palabas at dumadami na rin po yung kulane. Tapos ang stage 4 po, ito na po yung kumalat po sa ibang bahagi ng katawan gaya ng lungs, brain, liver, bones po.
Okay.
So, pag stage 4, wala na?
Ay,
O may
hindi po,
pag-asa
sir.
pa rin?
So, compared to 10, 20 years ago, improve na po ang science, detection, and tawag namin is subtyping ng breast cancer. So, hindi lahat ng breast cancer ay tinitreat pare-pareho. So, merong mga kababaihan po na merong tinatawag na hormone receptor positive, merong iba na HER2 positive. So, itong mga bagay po na ito, makakapagbigay kaalaman po doon sa doktor, mga manggagamot po, para po mabigay yung mga gamot na kinakailangan nila. Kadalasan nan po sa Pilipinas, meron tayong tinatawag na mastectomy. Opo, tapos meron tayong radiation, tapos yung ER/PR HER2 na pinapa-analyze po at Ki-67. Yan po ay mga para po malaman kung ano yung mga gamot na kailangan ng mismong bukol. So, kunyari po meron tayong 3 kababaihan, si Ana, si Lorna,
Si Lorna,
iba-iba. Iba-iba po ang pwedeng gamutan nila po. Even stage 4, ma'am. Even sa stage 4. So, sa stage 4, ito na po yung breast cancer ay nagiging chronic na disease na tinatawag, parang diabetes. So, kapag nagkaroon ka na, pwedeng po matagal po kayo mabuhay na kontrolado yung sakit. Pwede siyang pwede siyang may ibang living with cancer. Meron naman pong iba na as long as kontrolado yung mga kalat po, like marami na din pong mga stage 4 na bone diseases lang po. So, kinakalma lang po itong pagkalat ng mga bukol na ito, and they really have a quality of life.
Ano
Ano
yung
yung
treatment
treatment
options from the most
options?
conservative to the
Yeah.
most radical?
Sige,
At
Doc.
ako'y
Isa-isahin mo,
lalabas,
Doc.
sasagutin mo,
Ano
Doc.
yung
Treatment
treatment options from 0 to stage 4? Pakiisa-isa po, Doc.
Opo. So, pag pre-cancer lang po siya, usually tinatanggal ng lumpectomy. Yung area lang po tinatanggal with good normal tissue surrounding lang po. Negative margins. Tapos, pwede po siya bigyan ng radiation. Tapos, hormonal treatment as an optional. Tapos, ang ating stage 1 hanggang stage 2A, pwede naman pong i-analyze. So, surgery po, usually breast conservation surgery o kaya with radiation o kaya po MRM or modified radical mastectomy, yung buong dedet po at saka mga kulani tinatanggal. Tapos we have options po kasi na if hormone receptor positive, pwede natin ipatest kung pwede nating ipaskip sila sa chemotherapy at bigay lang ng hormonal treatment. Kadalasan po, after if iba po yung profile ng kanilang tumor, nagre-recommend na po ng chemotherapy, lalo na pag may mga aggressive features. Kapag po stage 3, pataas po, stage 3, usually, andyan yung option ng surgery, treatment ng chemo, and radiation. At kung kinakailangan ng hormonal treatment, dinadagdag na rin ho. Kapag po stage 4, nandiyan po yung, since kalat po, ang breast cancer, pangunahin po sa konsiderasyon is to check again yung molecular subtype niya, ER/PR, HER2, tapos marami na pong options. Ang kadalasan alam natin is chemotherapy, pero ngayon pwede na rin pong hormonal na upright. Yung number 1 na pwede pong i-recommend is pwedeng hormonal na. Meron na ding options for immunotherapy and chemotherapy for mga triple negative breast cancer. Tapos meron na rin po tayong mga targeted treatments, no? So inaalam na yung mga germline BRCA, etc. So para malaman kung pwede silang bigay ng
Doc.
tablets.
Doc,
Tablet.
gaano kabilis yung progression if you don't treat it? Halimbawa, in denial ka, no? Na-depress ka na dahil nalaman mo. From 0 to 1, 1 to 2, 2 to 2A, 2A to 3, 3 to 4. Pag hinayaan mo lang, mabilis bang progression?
So, may mga bukol po kasi na, so depende sa subtype na tinatawag, no? So, ER/PR positive, HER2 positive. Mga aggressive po kasi is HER2 positive, triple negative. So, itong dalawa na to, mabilis po sila. Yung doubling time, mararamdaman mo, may mga pasyente na nitong pandemic sinabi na nakapa lang ng October, after 1 month, mayroon na dumoble na ng November, ganyan. So, mabilis kasi ang profile ng tumor, meron tinatawag kaming driver mutation. So, ibig sabihin, merong talagang mutation na nagpo-push na dumami sila. May mga din pong mababagal, gaya ng ER/PR positive. So, yun, hindi naman po sila nagdo-double kaagad in a month or
So, hindi pare-pareho, that's what you're saying.
Yes.
Hindi pare-pareho ang progression nila. Pwedeng sa iba, buwan na
Mabagal.
maabutin or even taon, pero may iba naman na buwan lang, 1 month lang, nag-progress na kaagad. Ganun kabilis.
Opo, lumalaki. May iba nagkaka-surgery lang, tapos since hindi sila nakapag-treatment, in 3 months, bumalik ulit as big as before, something like that. Depende kasi sa laman, yung pinaka-mutation na nasa loob kasi po. So, if you have a very bad tumor, expect a fast progression po. That's why there are medicines. That's why there are medicines na pangontra.
Yes,
So you really need
yes.
to block them.
Pero naririnig natin, part si Ate B, may kilala yan. I'm pretty sure. Ako may mga kaibigan ako. I think 2 kaibigan ko, kilala ko, nawala. Sabi nila, nawala yung cancer na treat. Do you actually do that? Nung parang na sinicertify nyo na cancer-free ka na? O hindi, nandyan lang yan na anytime pwedeng mag-resurrect eh.
Yeah. So, yung po kasi, yung cancer, no? So, right, you can only parang acknowledge what has been evident or done. Yung may proof ka ba? So, wala ngayon. You do the scans, you do the mammogram, etc. Wala ngayon. Walang evidence. So, pwede natin sabihin at this point, you have no evidence of disease. Yun ang ina-associate po ng mga pasyente na cancer-free. Pero always yan with an evidence. You cannot predict the future because you can always get new mutations every now and then, di ba? From environment, no? Like for smoking, it will destroy your genes. Tapos your repair genes. Smoking will destroy your repair genes. Alcohol, obesity, and lots of these things. You cannot predict the future kasi hindi ba natin So, yeah, there's always a risk for it to come back. May mga exposures, like for example, yung prolonged estrogen, di ba? Tapos yung hormone replacement therapy. If you have these triggers, you have higher chances of getting breast cancer po.
Sige po, Ate B.
Okay. Bila ako napapahinto eh. Nung sinabi mo yung mga hormones, natakot ako bigla.
Oo, grabe no?
Oo. Doc, yung iba yung nagpipills, pwede ka bang magkaroon ng breast cancer sa mga nagpills ng matagal? Alam mo
mga 4 years daw, the evidence showed na pag 4 years, meron kang hormone replacement therapy, oral contraceptive pills, you have that chance of breast cancer. Now, ang good news is yung mga current pills, they have less of those na nagtitrigger na daw po ng breast cancer.
Okay. So, Doc, dun tayo sa sinabi mo kaninang, ilang beses mo sinabi kailangan mong i-block yung cancer, pwede mong i-manage yung cancer. So, kunwari may cancer na, baka dumaan na rin sa surgery before, naatanggalan na rin ng suso. Ano yung, how do you live with cancer at hanggang gaano katagal? Pwede bang humaba ang buhay?
Opo, definitely. So, earlier stage, early detection, early cure, early treatment, we're having, the statistics will tell us na around 99% pag stage 1, very good 5-year, 10-year survival. Now, paano ka mag-adapt afterwards? So, you continue self-breast exam, your preventive methods, no, do the exercise, do your your regular surveillance, no. Usually pag 40 years old, average risk, we start the mammogram for sonomammogram. Tapos pagka high risk, we advise you talk to a doctor para malaman if you'll do a frequent monitoring and also breast MRI and even genetic counseling. Tapos you mentioned regarding the how to cope afterwards. You you continue yung mga preventive alcohol, control your your weight and eat well. Opo.
Ayun.
So, sa mga kababayan po natin na may cancer, sabi nga kanina, hindi po siya death sentence. Nasa sa inyo. Nasa sa inyong mga kamay. Ano po? How you're going to live with it. Pero may mga options si Doc. Doc, anong mensahe po ninyo as a parting shot? Because ang haba na ng discussion po natin, naka 30 minutes na tayo, Doc eh. As a parting shot, what are the options for women and men who were diagnosed to have cancer?
Opo. So, alam ko po marami po sa ating kababayan, laging yung fear of the cancer. So, wag po matakot. May mga scientific or evidence-based na mga paggagamot. Pangalawa po is yung access. Lagi ang takot ng mga kababayan is yung gastos. So, it's important to know that there are DOH programs like the BC-MAP. Go to DOH related hospitals so that you can access this benefit for early stage breast cancer patients. So they can help you with the surgery and other medicines na yung mukhang mahal noon, at least ngayon na dudugtungan ng support. There's also the PCSO, DSWD, and also it's very important to know then to talk to your doctor if there are nearby cancer support groups. You can visit our website psmo.org.ph and look for the patient support programs. We have also there the Philippine Cancer Society is also helping women get medicines, no? So that's the main thing eh. They really don't know how to access yung medicine. No? Tingin nila gastos po. So there are agencies that could help. So pagtulong-tulungan po natin para po malusog po ang mga kababaihan natin.
Dr. Herdee, thank you. Maraming salamat. Marami kaming natutunan, Doc. Thank you very much. Ano po?
Thank you din po.
Bye-bye. Take care. Si
Bye,
Dr.
Doc.
Herdee
Bye.
Luna
Thank
po
you.
yan, anak. Thank you. At least may natutunan na naman tayo. Something about our health or women's health or even men's health, partner. Pasensya na ubusan po tayo ng oras, partner. Pero lilipat naman tayo sa kabila. Diba, Tibi? Ano tumutulog, Ate B, sa'yo? May pa-music ka ba dyan?
Nanay ko tumawag sa akin. Sorry.
Sige,
Meron
Tibi,
siya,
go.
may pinapatanong siya pero okay, natapos na eh. Eto ngayon. Syempre kung meron pong breast cancer for our humans, pati ho sa mga alaga natin, meron rin bang breast cancer?
Or
Madaming
cancer,
suso
for that matter.
or cancer, daming suso ng aso natin at ng mga pusa. Ilang piraso yan, di ba? May mga bukol din bang tumutubo sa kanila? Ngayong umaga, of course, let's welcome back to our show, our friend, Dr. Ed Unson. Doc Ed! Hi, Doc Ed!
Thank you very much to be here again. I'm glad to be
Ayun,
here.
ang ganda ng background ni Dr. Ed, parang ready na talaga para sa mga shows, ha? Si Dr. Ed Unson po, may-ari ng The Animal House. Kasi kaya suki po namin yan, napakabait po at talagang willing to share his knowledge po sa atin. Incidentally, i-chismis ko lang at si Doc, is also the former president ng Philippine Veterinary Medical Association. Tama, Doc?
No, the Philippine Animal Hospital Association.
Philippine Animal Hospital Association. Tapos
Yes.
yung grupo ng Philippine Veterinary Medical Association,
I was the
kaibigan ka
speaker.
rin, kilala
Yeah.
ka.
I was the Speaker of the House there.
Oo, nina Doc. Oo, ni na Dr. Baisik. So sabi ko, ang dami na naming vet na pwede nating ma-guest. Of course, aside from the vets of the animal house. Anyway, Doc, yung mga alaga nating hayop, kung ang mga tao ay nagkaka-cancer, sila rin po nagkaka-cancer din sila.
Yeah, interesting nga sabi nga ni Ate B. So breast cancer is common with women, lalo pa sa pets. So and mas marami po 'yan. So hindi lang isang pares, no? We have 5 pairs. So malaki, mabilis lumaki yan, and it's something to be alarmed. It's an increasing rate, no? One in 4 pets will get cancer in their lifetime.
Taas nun ah.
Dahil humahaba na po yung life ng pet.
Okay.
Pets normally live already now to 15 years old. So that's above 10 dyan na yung incidence ng cancer. But we see also cancer in young pets. So it's getting to be a more alarming disease like with humans. So these are chronic diseases, no? Na kailangan bantayan natin. Kasi, I mean, cancer is cancer. So medyo mahirap pag may cancer po yung pet, lalo pa sa tao.
Anong cancer meron sila, Doc?
Okay, well, the most common is there's the breast
Anong
cancer.
cancer meron sila, Doc? Anong cancer sila?
Okay, there's breast cancer, there's bone cancer, there's skin cancer. So there's melanomas. Maraming kasi yung unang sign is may bukol eh. May bukol. So skin cancer, there is lymph node cancer which are called lymphomas, parang sa tao rin. There is also there's blood cancer. So the different organs of the blood will have cancer. And there are also oral cancer, sa bibig. At saka marami pa yan, sa mata, so we're seeing a lot of cancers in pets. It's a little alarming. Sabi nga nila, ano ba yung dahilan? Dahil ba sa pagkain? Dahil ba sa stress? So parang sa tao, walang dahilan. There's no one reason kung bakit may nagka-cancer yung pet. So in isa pet, nagkakaroon sila, they'll say it's because of the genetics. It's proven that certain breeds, yung ibang lahi ng pet ay more prone to cancer. Example, yung mga retriever. Yung Golden Retriever, Labrador Retrievers, they're prone to lymphomas. Lymph node, that's very common with them, no? So, but the other breeds are fair share. No, you can get cancer even if you're not a Golden Retriever. But
so ang mas malalaking breed, mas prone sila dun sa sinasabi mong cancer. What about yung breast cancer? Anong breed ang prone doon?
Breast cancer is any female. Kaya it is preventable, no? So yung preventable dyan, hindi kagaya, well, we can't do it with humans, no? But sa pets, kinakapon po yan. If you spay the pet, you're decreasing the chances of breast cancer. And you spay the pet early in life. So that will prevent breast cancer kasi marami yan, ha? That's 5 pairs. So pwedeng 10 bukol or more. Sa lalaki,
yung sa babae po yun, sa lalaki ba nagkaka-breast cancer din?
there are some, but it's more prone sa pets in males yung prostate cancer. So parang sa tao rin, no? Sa tao, well, in dogs, these are things that are allowed, no? Kinakapon yan. So if you want to prevent prostate cancer, kinakapon yan. Sa humans, we don't castrate humans, no? We balance it through hormones. But yung sa dogs, nagkakaroon ng prostate cancer, hindi lang prostate cancer yung dogs, yung male, no? Nagkakaroon sila ng tumor pa sa puwet. So they can get also anal carcinomas, so around the anal, around the sphincter. Kaya yan ang advantage of neutering is you prevent prostate cancer and you prevent also tumors of the anal gland, anal region kasi nagkakaroon sila ng tumor.
Ano yun? Tatanggapin na lang ba natin yung doc as a reality or kaya ba natin ma-prevent?
Well, breast cancer and prostate cancer is preventable.
Okay. Sa breast, sabi niyo ho yung spaying. Yung
Yes.
sa ano rin, yung prostate, kapon ho ba will prevent it?
Yes.
So kailangan ikapon. What age naman po yung kapon for the boys? Para sa mga alagang
Also
lalaki?
between the first, maybe just in the first, pinapalampas muna ng 1 year, no? So maybe in the first year of life, between 1 to 2 years, kinakapon na sila.
Okay, okay.
If you want to
So,
prevent.
Doc, sige, Ate Bigo, ikaw muna.
Oo, kasi Doc, mga bukol yan eh, di ba? Yung sinabi natin, cancer, ang taas, 1 in 4, no, in their
Yes.
lifetime. Ang, ano yan,
25% yan.
paano natin
Yeah, 25%.
ma-detect? Oo, kakapain ba natin?
Yeah.
May blood test ba? Makikita ba sa blood test yan?
Well, normally, the first sign that you will see is yung bukol na hindi nandyan dati. O yung bukol na maliit na biglang lumaki ang bilis-bilis. So parang sa tao, pag may bukol na biglang lumitaw at saka ang bilis-bilis at nagdudugo, that's a sign that you have to check. Another sign also is namamayat sila. Hindi mo alam kung bakit namamayat sila. Tapos parang nawala na yung energy nila. So those are also signs na kailangan check up po yan. So again, it's always good to have a regular checkup for your pet kasi pagkaroon ng cancer yan, cancer treatment is not as wide as in humans. Kung makita mo sa ibang hospital ng tao, talagang they have radiation therapy, they have all the
Chemotherapy, no?
all the chemos, and they have also the linear radiation. Sa tao, pets, hindi po yan. That's very limited. Very, very limited.
So pag ang pet mo, Doc, ay na-diagnose na may cancer, ano yung options mo? Hahayaan mo na lang o you excise the tumor o paano ba?
Yeah. Well, always is the diagnosis. No? So any lump, tanggalin mo yan and then have it. First, you have, they call it a biopsy, a needle biopsy. So chine-check muna kung ano yan. Kung if this has malignant cancer characteristics, tapos tinatanggal na yan. And then we submit that to a excision biopsy. And then we can plan, no? Because kumakalat rin yan. So we do also scans. So you can do x-rays, you can do ultrasounds, you can do CT scans. So pwede rin CT scan sa pet, pero mas mahal at saka tulog dapat yung pet. Hindi yung tao na, sige ma'am, higa ka lang dyan ha. Yung pet, kailangan tulog yan. Wala na yan. That's already nullified.
Sila kasi hindi ganon. Ay, Ate B, nag-freeze pa si Doc?
Hindi, gumagalaw si Doc. Ayun
Doc?
Oo, gumagalaw siya.
Ayan, bumalik na.
Oo,
Nag-freeze ka na. Oo, nag-freeze ka ng konti. Ayan, bumalik na, oo. So, Doc, siguro, maybe mainam na we're going to talk about prevention. Kanina sa humans, di ba? Binanggit ni Dr. Luna yung mga reasons eh. So, anong reasons bakit nagkaka-cancer yung ating mga alagang hayop? Sa pagkain siguro, ano?
Well, sabi nila, but pets also, if they're on the wrong diet, they live shorter. So yung dog food, some say yung culprit dyan, yung commercial dog food. But I don't think that is the reason because many pets live longer also with dog food. At yung iba, kumakain ng niluluto yung pagkain, nagkaka-cancer din sila. So it doesn't mean that it's the food, no? But I think a lot of water is very important, exercise, avoid heavy dogs kasi pag a heavy pet, yan, nagkakaroon ka ng cancer.
Obesity na naman, oo.
Or even
Kasi
cancer.
cute eh. Cute ng, alam ka naman yung aso mo, pug o bulldog, tapos payat. Hindi cute na pag bulldog or pug, kailangan mataba.
Yeah, huwag
Diba,
masyadong mataba. Huwag masyadong malaki. And then also have the mouth checked because the mouth is also a common area for cancer, no? So pag madumi ang ngipin, they're prone to oral diseases, no? Have dental prophylaxis. So nagde-dental prophylaxis din ng pet, ha? And then also if there is also, they call that STD, no? It's a sexual transmitted disease. So it can cause tumors. So especially kung if you breed with if your pet nag-breed sa gala, yung pet na galing sa labas na hindi mo alam, tapos pala may tumor yan, pag na-mate kunwari na accident na na-mate, at may tumor yung pet na yan, minsan, most of the time that cancer is transmissible.
What?
Magkakaroon ng tumor sa genital yan, ha? So and that tumor is contagious to humans. So if the pet licks its genital, tapos didilaan ka, yan. See to it that walang tumor ang pet mo, ha? Because if there's a lump in the pinapabayaan mo yung tumor sa genital niya, dinidilaan niya, at kung may history na lumabas yan, nawala siya, bumalik, buntis, ingat lang dyan. Always have it checked because they call that an STD. It happens.
So, ayan, Ate B, sa mga fur parents po, na mahilig mag-kiski. Alam mo yung cute naman kasi mahal mo di ba? Hinahalikan mo, naglilik. Ang problema, kung galing yan sa labas, Dok, no, na hindi mo namalayan, nag-interact, nag-connect sa ibang aso na hindi naman naaalagaan, pwedeng i-transmit sa humans.
Yes. Well, if there's a tumor only, kung may tumor yan,
Oo. Ay, paano pag may mga parasites? Kasi syempre, hayop kasi sila, talagang nagdidila-dila, no? Kung ano-anong dinidilaan, kung ano-anong inaamoy. And then you also kiss them. Paano yung may mga parasite malilipat sa'yo?
Well, not parasites, no, but there are certain blood parasites or tick-borne parasites na galing sa kunwari pulgas, no. So there are certain things that can be lodged in the system. So in the CDC, no, in the US, naging issue yan because they were recommending do not kiss your pet or do not sleep with your pet. Naging issue yan kasi most owners have their pet sleep with them and they kiss their pet. And the mouth of the pet is very clean actually. Kasi it has a lot of enzymes, no, and good bacteria, but they're also prone to bad breath. So a lot of bacteria yan. So if you don't have regular dental cleaning, napapasa rin yan sa yan. So it's with caution because always pets lick, no? They love to lick, and it's cute, no? Pag tila kagad yan, tatabihan sa kama
Tigilan
mo.
ko na. Oo, tigilan na natin.
Tick and flea prevention, very important yan. Kasi pag hindi prevented ng ticks and fleas, kung walang tableta or spray, nagkakaroon sila ng parasite that can be transmitted to humans.
Doc, may nabanggit ka na oral. Anong sabi mo kanina? Anong klase ng cancer na dito? Hindi. Oral yung may cancer daw, Ate B, na dito Yung
there's oral cancer. So there's different tumors of the mouth, no? Of the oral cavity. That one is sometimes it's also because of poor dental hygiene. Okay, so if you're prone to bacteria, that will change everything. Then you're prone to cancer. Dogs and cats. Yung cats nagkakaroon ng tumor rin yan. Very common.
Okay. Kaya lang sabi mo tatanggalin, di ba? So paano mo tatanggalin kung nandito yung cancer ng ayot ng pet mo?
Well, early detection and early treatment, early surgery is important. Kasi kung hindi, pag-advance, you're caught already with a decision na patulugin yung pet.
But hindi patulugin, papatayin?
Papatayin na.
Yeah, sometimes and most owners will opt for that because ayun lang magastos, no? But it's also, chemotherapy is not, it'll extend the life, like with humans with cancer. Hindi can live forever, but you can extend the life. And right now, because of insurance, insurance can also help.
May pet insurance na?
There's different pet insurances that can help. No? So it help augment the cost. Kasi wala naman tayong PCSO for dogs. No? So you go through pet insurance and they can help you with the costs. So it's good to talk with pet insurances kung kasama ba yan sa insurance because you'd like to, it's a yearly thing. No? So hindi yung pagbayad mo forever ka magbabayad. Ito yearly.
Doc, konti lang muna yan kasi pwedeng ihiwalay na topic yan. Yes. Pet insurance. Maybe we can invite you again if you're very familiar with that. Familiar kayo sa ganyan topic, Pag-aralan nyo, Doc, tapos pag-usapan natin. Is it parang worthy? Ano ba yan? Cost effective ba yan? Yan, yung pag-usapan natin. And kasi medyo mahal din kasi mga ganyan, may cost. In future episodes, pakuha ka namin ulit tungkol dyan. But balik tayo dun sa cancer, Doc. Usually, anong age tumatama ang cancer sa ating mga pets? Kasi sabi mo, mayroon sa puppies, pero madalang naman siguro. Yan, adults usually yan, di ba?
It's sakit not usually ng adult yan. So normally, if your pet is 10 years and up, 50% of pets 10 years and up will get cancer. Some form of cancer. So
ang taas, 50%? Half?
Yeah, half.
Dok, nakakalungkot naman tong usapan natin ito.
So it's good. You have malignant and benign cancer. So may mga cancer na pwedeng hindi it's cancer but it's not the malignant yung kumakalat na mabilis.
Okay. Yun ang kasi ayaw naman nating ma-depress tayo mga for babies, for mga bisnito, at for parents. Doc, how do you live with cancer? Kung pwede po sa mga humans yan, sa alaga din ba natin, pwede namang humaba yung buhay nila? Or baka naman, pwedeng pain-free yung kanilang cancer journey?
Yeah, so it's very it's now a reality of cancer, dealing with cancer. So they call it pain management, and there's palliative care. So we don't want any pet to suffer excessively. Okay. Before, walang concept ng welfare is pain. Ngayon, pain is part of the animal welfare. So how to deal with pets with cancer again is one is early detection and early treatment. Okay, if a pet has it, don't wait for it to become worse because mas magsasuffer yan. So see to it that if it can be excised, again, surgery yan, tinatanggal yan. And then depending on the treatment, some don't even need chemo. Some will just, like breast cancer, you don't need chemo. Unlike sa humans, may chemo yan. Sa breast cancer, tinatanggal yung lahat ng mammary glands. And then you take out also the uterus and ovaries. So that's a more radical approach, pero hindi na babalik yan early. So other treatments, if it is advanced, there is always we have pain management for pets, and we also give tips on special food, special care, how to deal with a pet with cancer. Now, naging popular, people will always look for the alternative, So alternative medicine is also alternative, meaning it's not yung Western. Mm-hmm. So like also with humans, the alternative can be attractive pero walang masyadong studies. So biglang pag kumalat na yan, wala na. It's too advanced, the patient is suffering, tapos hindi tatanggapin ng doktor. O parang mahirapan yung doktor. Sinabi ko sa'yo, dapat hindi ka nag-alternative. Okay, so naipit man yung tao. But there are complementary. So meaning you use Western and you use complementary. So immune, you try to boost the immunity of the pet para may panglaban siya. Mm-hmm. And it's not, and a lot of care. So watch the diet, but there is immune boosting medications and chemotherapy. Or if not, just some pets just take it out and you don't need to do chemotherapy. You just have to do regular checkups.
Oh, Doc, nabanggit sa humans kanina ni Dr. Luna na a portion of it is hereditary. Mm-hmm. I don't know with pets, yung sa pets ba may ganyan din silang factor na yung pinaka-ancestor niya ay prone sa cancer. Ibig sabihin silang mga offspring, ganun din. Or yung isa nagbi-breed, baka magkakamag-anak na yung binibreed. So parang hindi na maganda yung genes. Pwede bang ganun?
Yeah, well, certain breeds, I like the golden retriever. So the breed is prone. So right now you can also do genetic testing. Is your pet carrying the gene for this cancer? Okay, so it's expensive.
May ganung test?
Yeah, it can be done. Pero pinapadala sa ibang bansa yan. So not everybody can do it. But yung mga interesado, kunwari magbe-breed ka, ito ba yung golden retriever is prone to lymphoma? Or is this dog prone to bone cancer? So that one you can have that tested.
So may ganun pala po, no? What about yung, halimbawa, yung parang may incest? Di ba may ginagawang ganun? Pati mga magkapatid, pinagkakasta, may ganun. Yung lalo na yung mga,
yung breeders,
breed, Doc?
Sa pet kasi,
yan ba ay nawala ba si Doc? Yan ba yung Doc ay nagre-result sa iba't ibang sakit ng mga pets natin?
Yes, because of the inbreeding. No? If there's a lot of inbreeding, it will bring out the weakest part, the weakest genes. No? So bring out the best genes, or it can bring out the weakest genes. So it's best not to do, they call that direct breeding or line breeding. You cross out first. Kasi ginagawa yan. That's why pets are more prone to so much diseases. Kasi kamag-anak lahat yan. Para gumanda, at saka para lumago yung breed nila, you have to breed sometimes siblings, but it's not recommended. So yung mga breeder, they'll cross out first to another line, tapos babalik sa line nila. Yeah. But it brings out also certain cancers. But you can do, for those who are really particular, you can ask your vet, and that can be done through genetic testing.
Okay. Sige partner, go.
So yung cancer pag natanggal, kumakalat din ba yan? Bumabalik-balik parang sa tao din?
Yeah, there's also there's also metastatic cancer, no? So especially those that are if you do a if you just take it out without checking screening, kunwari, may maraming bukol, pero you didn't do a check kung kumalat na sa lungs, because the lungs is usually the first area that was spread. So is it something that you would like to do, or is it something that you wouldn't like to do? Kasi yung iba, pag ginalaw yan, wow, after 1 week, sabog yan. Kalat yan. Especially the lymphomas. So it's not good to touch lymphomas. Chemotherapy yan.
Doc, meron din bang colorectal cancer yung mga pets natin? Kasi ang susunod kong tanong is, maybe it has something to do with the diet kasi ang dami nilang protina, di ba? Karne, ang kinakain lagi.
Yeah, there is, colorectal is also common. But it's not, unlike with humans, you do a colonoscopy, no? With humans, with pets, we're starting to do biomarkers and we're starting to do scans. But again, mahal yan, it's not for, it's more for those who are really particular. So, meat eaters, like with humans, kung high meat diet, you're supposed to be more prone. But dogs are not, they're carnivores, but they're omnivores also kasi kakain din ng
Gulay.
Kakain ng damo, kumakain ng damo.
Dahon.
But they're called carnivores because you have the teeth, no? You have the canines. So they're very developed yan. But they'll mostly eat meat. So right now, may mga fad, no? So others will keep it raw food. Others will go on the vegan diet. Others will be vegetarian, grain-free diet. So iba-iba. So
Oo nga eh.
yeah, it's a little confusing because there's not really much studies.
Okay.
Most important,
Kasi kaya napaganyan ako kasi ako yung hindi ako nagpapakain po kay Uni ng yung mga pellets, hindi po kasi natatakot
Ay
na
talaga,
ako.
TV? Ako pellets yung pinapakain ko naman.
Pinakulo ang
So, hindi
karne
pala
pala niya
dapat?
si Uni. Hindi ko nga alam kaya ang sabi ni Doc baka fad diet nga lang rin yung akin.
well, it's common. I recommend it for puppies. Feed the pellet diet because the puppies, they're growing breeds. Ang bilis yan. They will grow very fast, so they need balanced diet.
Sa adults?
Pag adult, yan, pwede nang mamili, no? But again, ayaw mo yung sobrang taba, sobrang asin, and then certain pets, allergic yan. So, kailangan ka magluto kasi allergic yan sa pagkain. Yung iba, they get diarrhea. So, you might have to use homemade diets. So, homemade diet is acceptable pa yan, no? Pero wag naman yung tira. Yung hindi mo kakainin, wag mong pakainin sa pet yan. So it's something that, and then hindi yung pa-iba-iba, may ulam, may bukas, may spaghetti, hindi yan. You eat the same food. You can cook it, but it's the same food. Kasi kung hindi, magiging mapili yan.
That's
and then
right.
if there's really ingredients,
So hindi din advisable pala na iniiba-iba. Dapat pare-pareho.
It's best, no? Creatures of habit sila. And if they want this diet, like if you want, if you keep changing, they're prone to, aside from being picky, they're prone to obesity. And they're also prone to cardiac diseases kasi hindi mo alam kung ano yung protein dyan. You'll have all the additives, certain things na para maging masarap.
What about, na-curious ako, di ba sabi mo yung dogs kumakain ng dahon? Yung cats ba, kumakain din ng dahon o puro karne yung cats?
Well, cats are omnivores also. They like fish, no? They like fish. Certain cats will eat. They will eat certain fruits, no? But generally, cats kasi are very mapili ang pusa.
Ayaw niya eh. May pusa kami dati. Ayaw kumain ng dahon.
Yeah,
gusto niya karne lang or fish.
Mas gusto lang ng pusa ang karne of fish. But others will add already some gulay. Sinasanay nila pag bata. Or you puree it. So, nahalo yan. But mapapansin mo yan, yung cat food, walang vegetarian diet, no? It's always diet, liver,
Yeah.
Yeah.
Yun ang gusto niya. Yung cats ba, anong cancer prone naman sila? Kasi baka sabihin, focus kayo palagi sa dogs. Yeah, cats also. Ano bang prone ng cancer ng cat?
Also, they're prone to mammary gland tumors, the breast cancer. They're also prone to skin cancer. They're also prone to oral cancers of the mouth. They can have also bone cancers. They can have blood cancer. So they can have also all the cancers. No? It's more, the dog is just more prone, certain breeds like the lymphoma is very prone. In cats, you have the leukemia. Certain leukemias can also cause cancers. So if there's a feline leukemia virus, they'll be more prone to viruses, to cancer. And that usually is oral cancer. Cancers of the mouth. Common sa pusa yan.
Alin mas mahaba ang buhay, ang aso o ang pusa?
Well, pets, sabi nga, yung cats have 9 lives, no? So yung cat ng 20, pwedeng 20 taon. Lampas pa, dati may pusa akong na-handle, 30 years old. Hindi ako.
Wow!
Pero 30 years old. Pero mukha siyang 30 years old. No? Pets, maswerte ka kung mag-15. Right now, there'll be maybe 10, 12. They're living longer. They can live up to 17, 18. But they're living longer now. In the Philippines, before, maikli ang buhay dito. 6 years, 5 years. Iba na. Patay na yung dog. And then you accept it like, mahina yung, ganyan.
Oh.
But now pets are growing, are staying alive longer.
Parang tao
So
din.
generally speaking, mas mahaba pag may alaga kang pusa at inalagaan mo ng maayos, mas mahaba ang buhay niyan kesa sa aso na inalagaan mo rin na maayos.
Well, they're more prone to live longer lives, the cats, no?
The cats.
20 years is mahina ang 20 years sa kanila. They can live longer.
Oh. Ate B, lumipat tayo sa pusa. Ate B, alaga
Okay,
din tayo
gusto ko na
sa
pusa
para
na
mas
lang
mahaba.
tayo. Totoo, naisip ko rin makapag-alaga nga ng pusa. Ay, naku, Doc. Pero next time, Doc, pet insurance, magandang pag-usapan yan. Ibig sabihin,
It helps a lot of pet owners now. And
okay.
just to understand it will be some good discussion.
Yes. Imbitahin ka namin ulit, Doc, ha? Let's talk about
Sure.
pet insurance. Pero siguro yung parting shot nyo po, paano alagaan yung ating mga pets? Pusa man yan, hamster man yan, ahas man yan, unggoy man yan, whatever man yan, from preventing them from getting cancer.
Okay, yeah. Well, again, proper diet, regular veterinary checkups is a must. Also avoid having your pet very heavy. Okay, doing all the preventive so that you can have diseases that are not because of poor nutrition or because they were not checked. But to have a cancer-free dog, you'll see yung mga aspin. Aspin, common sa kanila is, yan yung aspin meaning yung mga gala. Common sa kanila is the sexual transmitted disease and breast cancer kasi napapabayaan yan. But otherwise, ang haba ng buhay nila. They can live very long even without cancers. No? But again, certain breeds are very prone to cancer. So study your breed. No? Study the breed and then maybe do some checkups with the breeder. Nagkaroon ba ng cancer mga siblings niya or the parents or the grandparents? Is it something I should be aware of?
Yeah. Okay. Quickly. Mas mahaba ba ang buhay ng purebred kesa sa hybrid?
Certain purebreds have shorter lives.
Oh, okay. Okay. Kasi Ate B, si Bluana, parang hybrid yun ng Husky and Dutch. Oh, so generally speaking, mas mahaba ang buhay ng hybrid kesa sa puro.
Can be. I mean, I think more in the care. Huh? But we've had many long pure breed, haba ng buhay. We've had many pure breeds, ang ikli ng buhay. Cancer
nasa pag-aalaga mo, nasa pagmamahal mo.
Yes, and then early checkup kasi pag may bukol, tanggalin mo kagad yan. Have it removed right away.
Okay. Doc, thank you.
Thank
Pabalik
you.
tayo sa pet insurance. Maraming salamat po. Dr.
Maraming salamat rin.
Ed. Thank you.
Doc, thank you for
Dr.
always
Unson.
being there.
Thank you po. May-ari po ng The Animal House. Visitahin niyo si Doc if you wanna see Doc. Kasi pogi si Doc, partner artistahin eh. Kung gusto niyo talaga makita si Dr. Ed, Makati kayo pumunta. Hindi dito sa Quezon City na branch. Thank you, Doc.
Okay, thank you. Happy Sunday.
Salamat.
Happy Sunday. Gusto ko lang makita sila Doc pag-check up. check up ko lang gusto makita si, wag na yung mga emergency.
Yeah.
Oo, punta mo si
Oo,
Doc.
check up
Ano din sa
lang
Makati.
ha.
Animal lang. Thank you, Doc. Bye-bye.
Okay,
Good
bye-bye.
night. Good morning. Bye. Thank you po. Maraming salamat po sa pag-monitor nyo sa amin sa aming tape episode. From time to time, nagtitape po tayo dahil may mga lakad. Pero ang importante po nito, meron po kayong matutunan. No? Hindi naman yung interaction sa amin kung hindi ko ano mapupulot nyo sa kada episode. Kaya, ang sabi ni Ate BI, if you like it,
Like, share, and subscribe to our channel. And don't forget to click on that notification button para alam ninyo kung kami ay naka-ere. Okay ba?
thank you. Salamat po. Si Alvin Elchico po ito.
At ako po yung Ate B, Bernadette Sembrano-Aguinaldo. Sabi nga natin, mula noon hanggang ngayon, ang kalusugan po natin ay nasa ating mga kamay. Huwag po nating pababayaan. Ingat! Until next time, dito pa rin sa... Thank you, Doc.
Thank you, Doc.
Thank you.
See ya.